Well, good afternoon, everyone. We want to thank you so much for joining us for another Orla webinar. Today, we have a focus on all hazards sheltering partnerships and how crucial those are to moving our state forward collectively. My name is Jason Brand. I'm the president and CEO of the Oregon Restaurant and Lodging Association. We have three guests joining us today, and we're greatly appreciative of them all taking their time over the next hour to talk about both the bigger picture and all the different needs we have for sheltering for all types of different reasons, but also to kind of work that down to the local level. So as a lodging operator, you can take a look at opportunities for new and advanced partnerships for your operation. Just a reminder to all those that are joining us today, the webinar is being recorded. So you will have access to both the recording itself as well as all of the presentation slides. If you're registered, then those materials will be sent to your email addresses. Thanks again for joining us. So with that, I want to go ahead and kick it off. We're going to start by working at that bigger picture level and working down to the local level. So Jeff Gilbert is actually best prepared for the bigger picture situation in Oregon and how lodging operators are best equipped to assist with the various challenges that are presented to us here in the state. Jeff Gilbert is the Regional Emergency Coordinator for the Oregon Department of Human Services. Following Jeff will be Sarah Boudreau, and she is the she is the Public Health Modernization Lead for the Oregon Department of Human Services. And following Sarah will be Dolly England, the Community Engagement Program Manager for the Oregon Health Authority. So with that, Jeff, we'll turn it over to you, and the floor is yours.
Great. Thanks so much, Jason. We appreciate the opportunity to be with you all today. We do have a number of elements. If you have the ability to take a look at your slides, if I don't look directly at the camera here, I'm looking at the slides. So don't mean to be rude. Yeah, I'm the Regional Emergency Coordinator for Oregon, the Emergency Management Unit. Fancy title, it basically means during times of crisis, my unit and I get the opportunity to feed, shelter, and provide basic social service wraparound supports. We've been in existence for a relatively short period of time. And Dolly, if you would advance this to the next slide, pretty please. Thank you so much. So for those of you that are not aware, in the state's constitution, the Oregon Department of Human Services, the largest state agency in Oregon, has the legal responsibility for what we refer to as mass care. And mass care is, like I said, feeding, sheltering, watering of all Oregonians, irrespective of income, location, or any other demographic factor during times of hazard. And hazard is a very ill-defined term. It can be something as simple as a bit of a heat wave comes into the area. We need to provide sheltering support to ensure those folks that don't have adequate supplies and protection are such, all the way to the most extreme, which we'll talk about on the last slide, which is the Cascadia Subduction that Oregon needs to really prepare for because it is imminent. So if you take a look at our emergency management unit, when the wildfire struck last Labor Day, it was a huge rock in the pond. Oregon was ill prepared for such a large catastrophe. To be perfectly honest, emergencies just don't happen in Oregon very often. And when these wildfires ravaged, it got to the point of a presidential declaration. That rarely happens again for Oregon, although potentially with the warming that we've been experiencing and the drought that Oregon's been experiencing, it looks like this is going to be a perennial reality. And so my unit was created literally as a result of the fires of last year. So it's a relatively new unit, but obviously this last year has seen a number of catastrophes affecting Oregon to where this unit's been exceptionally active and engaged. Dolly, if you would, please. So this you kind of see some of the fancy terminology that goes along with it. It's a nice little graphic that helps kind of explain that the dot in the center talks about kind of how emergencies are viewed from the state and from the federal level, right? An incident occurs, and then we move immediately into what we refer to as this response phase, which is sheltering, feeding. We move into recovery phase, which still has sheltering and feeding, and ultimately trying to get people back to where they belong originally. And then it moves into mitigation, where we study the issues to learn exactly how those happened so that we can put measures in place to forestall them from occurring again. And then finally into kind of protect and prevent, and investing more large scale dollars in terms of systems that can make that happen. we really are just still in the recovery phase from the 2020 wildfires. To recover from wildfires takes longer than almost any other natural disaster that strikes in the United States. That includes hurricanes, tornadoes. If you've been through those events, wildfires really destroy systems even larger than what some of those others do. And so recovery takes a lot longer period of time. We fall into what we call the Emergency Support Function 6, ESF 6, that is mass care. And that's why I've come here today to talk to you. Dolly, if you would please. There we go. That's kind of a haunting picture that I selected there. One of our operators, one of the motel there, really impacted and destroyed. A quick snapshot as a result of the missions that my unit is currently engaged in. So you kind of see the scope of what we're working on. The 2020 wildfires that affected 8 counties, we still have 650 individuals are still being sheltered to this very day, a year and a month after the fact. And that's a pretty significant number, a little bit more than a year later. If you can imagine actually residing in one of your hotel properties and one room is your home with everything that you own. We also engaged in the winter storms that really impacted Oregon, very significant winter storms. Some counties were without power for a 3 to 4 week window of time. That would really hit Oregon hard this year. Massive drought declaration that has reached the president's desk actually in multiple counties, but specifically in Klamath County, where we actually have to provide water in large water buffaloes to families so that they can still reside on their properties. Heat waves, massive number of record heat waves, 4 heat waves that actually went through, getting 3 of those heat waves declared by our governor as a state of emergency. Those are pretty extensive throughout the state. Obviously, the 2021 wildfires we're familiar with. Well, I think nobody in the room probably would not know the bootleg fire and the impact that it has had. And then hospital decompression and isolation and quarantine. I know that Sarah's going to talk about that a bit. And the last mission that we just engaged in, we've started and will take us through the end of June, is the Afghan refugee mission. And the numbers that are coming here to Oregon will be fairly substantial. Scope of missions, just so you kind of see what that looks like, 4,367 families required sheltering as a result of the 2020 wildfires. Right, a lot larger than I think most people really understand or realize. And all of those have gone through our hotels here in Oregon through the various folks that we have contracts with. You can see that we've had contracts with 76 hotels and motels currently right now, and we need to expand that significantly in order to deal with all of the different calamities and catastrophes that we foresee Oregon experiencing in the next few years. The duration for the mission extends through June of 2022 because of the lack of housing. That's part of the big issue here in Oregon. There's just no place to move people to. And like I've indicated, the Afghan mission is projected currently at 300 plus individuals. It could actually hit an upper bound of 3,000 individuals, depending on the level of funding that can be acquired through the state of Oregon. So at the end, we need more partners. And the hope is that this presentation would help you want to become a part of that mission. Dolly, last slide for me. And so future all hazard needs. We know that there's a pandemic, we're not done. I wish it was, but we're not. And depending on what that's going to look like here with the different variants, that's significantly hit Oregon and in some counties much harder than others. And the need to be able to rely upon partners such as you is going to be very valuable for us. Hospital decompression along the exact same lines in order to provide our medical providers with the ability to have a little bit of space so that they can provide good medical coverage for everyone, not just folks experiencing the pandemic. The Afghan refugee situation, that's a very large undertaking that Oregon is having right now. We know that winter storm preparations are beginning because of the massive wildfires. Rains, which were really hoped for, rains now cause another catastrophe that we're worried about with slides, mudslides, and with potential flooding in areas because the natural soil is going to be sloughed off when that rain hits. And so that's a big issue for folks. Wildfire relief. is a massive undertaking that we're continuing to take a look at, even though we're looking right now going into the fall. And we as Oregonians think, oh, great, the rains have saved us. We would have to have an incredible rainfall this year and a snowpack, which neither of those are predicted, by the way, in order to even begin to scratch the drought that we have in some locations. And last but not least is Cascadia. And this is the one that Oregonians have heard about, but really have not planned for or prepared for at all. And just taking a look at the scope of Cascadia, 27,600 households will be displaced. That's a conservative number at this point in time. 3 to 6 months of no power along the coast and along the valley regions. 6 to 12 months in order to restore roads. That's not bridges, by the way. Bridges are years to restore, right? So the Portland metropolitan area, those bridges will be down for a very long period of time. And 18 to 36 months to rebuild medical facilities that would be destroyed. We're not mentioning schools and other such locations. And so I didn't come to talk about doomsday. I came to talk about the reality, however, and the state needing partners. And we have had amazing partnerships to build those. The state is anxious to build contracts with every and any motel or hotel feeding vendor that it can provide, because we just don't have the capacity otherwise. And so we're a great partner, I promise. We're very trauma informed. We're very personal. It's not like dealing with the government as a large entity, but having those partners is the only way that we're going to really help Oregonians and how we're going to really save the day when a large catastrophe occurs. So if you would like to participate, if you'd like to know more, please reach out to me. I can provide any and all information, and really would love to work with you to establish contracts with all of your hotel motels in order to address future needs. So thanks for your time.
Thank you, Jeff. Great job, and really eye-opening information that you're already starting to share in the first part of this webinar with our folks. And I know it'll be really helpful to them as they have more internal conversations about how to best partner with the state. And as Jeff mentioned, just a reminder, there's contact information in the chat box. All of our panelists today are very easy to get in touch with. So we just want to encourage everyone to take the time to reach out, ask your specific questions either in the chat box, and we'll get to those at the end of the presentations, or reach out to them directly via email. So with that, we'll turn the floor over to Sarah Boudreau.
Great, thank you very much. Thanks for having us here today. I just want to start with a huge thank you to all of you who joined today. Throughout the COVID response, we could not have done what we have done here in Oregon without hotel and motel owners and operators stepping up and working with local public health and community-based organizations. It has been absolutely critical. So if you are one of representing those hotels and motels that are already working with local public health and community-based organizations, thank you. And we really want to hear from you about how we can continue to make improvements on how we're coordinating. If you're not already working with local public health or community-based organizations, we're here to answer your questions and also hear what you need to be able to start making those relationships. Next slide, please. So I'm going to talk just briefly about who is your local public health authority and what they do. The local public health authorities and community-based organizations that Dolly is going to talk about in a minute work very closely to provide safe locations for people who need it during the COVID-19 pandemic. So Oregon has 32 local public health authorities in our 36 counties. Generally, the local public health authority falls within county lines. We do have one health district that's 3 counties combined, Wasco, Sherman, and Gillum counties. And then we have two counties where the state of Oregon Health Authority provides public health. There is no local public health authority on the ground, and those are Curry and Wallowa counties. So your local public health authority is a part of county government. Their mission is to protect the public's health from the spread of disease and to promote health in local communities. There is a lot of variability in how local public health authorities are structured and the services they provide. That can be a little bit challenging for folks on the ground. So if you have hotels in a number of different counties, you might find that that you have different relationships with the local public health authority because they're not all the same. But generally that flexibility is a good thing because it allows local public health to be very responsive to the unique needs of their own community. So local public health authority, the services and activities they provide that they're statutorily required to provide range really greatly. And I listed just a few here. So investigating diseases, disease outbreaks and epidemics, enforcing the Indoor Clean Air Act, family planning, restaurant licensure, regulating our public water system. So all of those are within the scope of what local public health authorities provide. Next slide. So getting into COVID-19 a little bit more, and here's some information about isolation and quarantine. So first, just to define those terms, quarantine is the term that's used for a person who has been exposed to a disease, but is not yet showing any signs of having the disease. They don't have any symptoms. So they're asked to quarantine to keep themselves separate from others during that period that they may become infectious and they may start showing symptoms. So it's preventive to kind of get a handle and make sure that that person is not able to expose people before they even get sick, if they're going to get sick. Isolation is the term that's used for a person who does have the disease. In this case, we're talking about COVID. So they're a confirmed case and they are asked to isolate or stay away from all others while they're sick, while they're potentially infectious and can spread it to others. So providing safe places for shelter during isolation and quarantine, it's routine business for local public health authorities. Government has been doing this since the time of the colonies. Government at that point would use isolation and quarantine for diseases like typhoid. But your local public health authority is doing this all the time. Tuberculosis is another disease where they frequently have to isolate and quarantine individuals. Local public health might be providing shelter for someone for diseases like some sexually transmitted infections when the person is high risk. For example, if it's a pregnant woman who doesn't have a safe place to be and they need to have shelter while they're undergoing treatment and getting well. So those are some examples of when this is happening all the time. What's different here is the scale of COVID and local public health authorities and CBOs needing to place 10, 20, 30 people on any given day in a safe place to complete quarantine or isolation. So what I want you to know is local public health knows how to do this. They know how to keep the person safe. They know how to keep hotel and motel operators and staff safe. They know how to keep other guests safe. And that is their first priority in all of this. Also, I just noted on this slide, you're fine. There's just a little note that, way back in the early days of this pandemic, county governments were required to demonstrate that they had agreements in place with hotels or motels or other locations. They had to demonstrate that to the governor's office in order for their county to start reopening. So different ways a local public health authority and CBO might use, community-based organizations might use to book rooms. So local public health might contract or lease with a hotel or motel for a block of rooms where they're paying for those rooms regardless of whether or not they're used. Most commonly is that row in the middle, where local public health authority or a CBO holds an agreement with a hotel or motel to book rooms on an as-needed basis. So these agreements are good because it outlines the responsibilities of all parties involved. It allows some agreements around payment to be in place. And, something that's very important to local public health is they still are able to minimize the amount of information that's shared about any guest when they're booking a room. They might share the person's name, but they're not sharing any information about what disease the person has, whether the person has a disease, anything like that can remain protected. And then the last piece there, sometimes local public health or CBOs are booking rooms without having any agreement in place. This has resulted in some challenges during the COVID-19 pandemic where, a situation comes up where a hotel employee, for example, or another guest suspects someone might have COVID. And it just becomes a very, very tough situation and all involved, I think, largely stemming from the fact that people don't feel safe in that situation. Okay, let's see. My last slide for today is to talk a little bit about what local public health authorities and CBOs do, the steps they take to make sure that hotel staff, operators, and other guests are safe. We do have all of this in a best practices document, which we are happy to share after today's webinar. So as I've already mentioned, local public health and CBOs are committed to ensuring safety for everyone involved when rooms are used for COVID-19 isolation and quarantine. We know that a hotel operator can safely accommodate routine guests and guests for COVID-19 when they're working with local public health or CBOs to use these precautions. So first, the local public health or CBO will provide explicit instructions to a guest who's in a hotel for isolation or quarantine. These instructions include things like the person should only be contacting the LPHA or CBO for assistance. They should not be going to the front desk or asking hotel or motel staff to come to their room for any reason. They should not have visitors. They should make all efforts to stay in their room. And if they need to leave their room for any reason, like to take a break outside, they need to be physical distancing. They cannot use shared facilities like laundry facilities, and that they need to comply with all other hotel policies. So these are the sorts of things that local public health and CBOs is doing in the background. Number two, assess each guest's unique needs to be successful. And I won't sugarcoat this. This is a challenging issue. Sometimes the people in greatest need for a safe place to shelter are people who might have more challenges being successful in that setting. Local public health and CBOs do everything they can to assess what the person's needs are and figure out how to meet them so that the person is going to be successful. Coordination with the hotel or motel operator, coordinating check-in, check-out, anything like that, just making sure that everyone knows what's going on and who's responsible for which pieces. Arrange the services to be provided, such as linens, or making sure the person's garbage can be taken out if it needs to be taken out, as well as providing food. Staying in contact with the hotel or motel operator if any issues come up. The local public health authority or community-based organization should be available to you to work through any issues that come up. Working with you on cleaning protocols and making sure everyone knows what needs to be done to make sure that rooms and facilities are safe. And then last, paying for any property damage that occurs. Local public health and community-based organizations can use funds that they get from the state of Oregon to pay for property damage that occurs when a person is in a hotel for COVID-19. We absolutely do not expect that these costs would fall on the shoulders of hotel or motel owners or operators. If for some reason the local public health authority or CBO can't pay it for one reason or another, you just need to reach out to our team. We will work it out to make sure that you are not responsible for costs like this that come up. So that's my last slide. I just want to encourage you all, if you are not already connected with your local public health authority, and want to talk about how to work together, to reach out to them. Thanks, Dolly. Turn it over to you now.
Thank you. And all of this to say, this work is our most excellent adventure. We are learning a lot, and we need more friends to go along the way. So that's where I come into play here. Is I am Dolly England, She, Her, Queen, Community Engagement Program Manager, and we are the community engagement team. When COVID hit, we pulled together a staff of community engagement coordinators that are located across the state to help support 3 bodies of work that we've funded community-based organizations to do. There is contact tracing, wraparound support, and outreach and education. This is our map of kind of how we are regioned out, and this is based on the state's emergency preparedness map. So what we do is we work with over 170 community-based organizations all across the state. We also are working really closely with Sarah and local public health authorities, as well as Jeff's team at ODHS and other staff here at OHA. We provide ongoing assistance through conversations and technical assistance. We support relationship building and workflows between community-based organizations and local public health. And we elevate, reflect, and share community feedback. And there has been a lot of feedback about need for sheltering and more connections, especially with our 3 funding areas. So there's outreach and engagement, contact tracing, and wraparound support services for individuals in isolation and quarantine. So the state is giving funds to CBOs to support local public health in the COVID response. And as folks are identified through the contact tracing process, we are needing to help with the isolation and quarantine. And in some cases, folks were needing to be sheltered within a hotel setting so that other members of their household weren't also being exposed to COVID. Folks that might be unhoused and or who are ill and need a place to recover. There's all kinds of different scenarios that have come up and that we've approved for folks to seek shelter. So we continue to develop this network between community-based organizations, local public health, and OHA to circulate the feedback and the need. I really wanted to highlight the fact that our CBOs are doing much of what Sarah mentioned with local public health. And the difference really is that our CBOs might be paying online in some cases. They might be doing it a little more anonymously. It's just the way that they have access to it. We would love, as Jeff mentioned, to develop additional partnerships and relationships with you all so that our community partners who are contracted to do this work on behalf of the state are able to get folks the services that they need. I also just wanted to make sure that you know about the various resources that OHA has available. These are just 2 pictures of some printed materials that we have. And I've listed a ton of resources in the resources for hotel operators page of this slide. I also have some information here just about indoor considerations for small spaces. There's a bunch of stuff for staff and employees. And we're public health, so I have to just mention some general COVID-19 resources around testing, vaccine, as well as booster information. We're basically awesome, and we want to be your friends. And this is our last shout out to reach out to us today. If you are interested in partnering with Oregon Department of Human Services and Oregon Health Authority around some contracting to make sure folks have the resources they need to be successful and healthy and safe. So I'm going to hand it back over to you, Jason.
Okay, well, thanks so much, Dolly. Great job to all 3 panelists, and way to keep the information compact and concise and easily usable for the lodging operators that are attending today, but also as they review it with others in the future. So I guess I'll start with kind of the initial question out of the books. If you have never done this before as a lodging operator and you're considering a partnership, maybe you're on the fence, who out of the 3 of you should they reach out to first? They have all 3 of your contact information, but who should they start with?
I'm probably going to vote Jeff because Jeff knows all the things.
It would probably be the most beneficial, and not wanting to hog any great partners, obviously, share alike. But our agency has built, ODHS has been able to build those contracts with folks and be able to share with an interagency agreement with OHA. So we kind of have the process set up to build those POs and build those contracts for a year at a time.
Great. Kind of a follow-up question to that too, Jeff. So you mentioned, trying to break down the barrier of it being just a massive government that's hard to navigate to actually execute on a contract that meets the mission and the goals that you've established in the presentation today. So how long does it typically take once they reach out to you, Jeff, and they start exploring it? If a lodging operator does decide that a partnership with local public health is right for them, what's the timetable they're looking at before they might expect to receive maybe their first overnight guest through that partnership?
Well, in order to establish the contract, it used to be a very long period of time. And if you took a look in the chat, Carol, who's done a remarkable job and a remarkable partner for us, when we first went down this road at the start of the first 2020 wildfires, we kind of inherited the system that the American Red Cross had established. And it just, that the nonprofit didn't work for the state. It really was a clunky system that we had inherited. And so we've kind of rebooted. We've started with new staff, and now we've really expedited with contract and procurement. So ODHS has to work with another agency, contracts and procurement, to actually write the contract that's verified by the Department of Justice. That used to take weeks on end. And now the new contracts that we have with the for the refugee mission that we have literally takes a couple days. Right. So it used to take weeks. Now it takes a couple of days. And I think you saw, Carol, there were some issues regarding billing in terms of what that looked like and how people were being recompensated. And so we ask our contractors now, do you want to be paid on a monthly basis? Do you want to be paid on a bi-monthly basis? And those now get expedited within a week's time, and they can be electronically deposited into people's accounts. We've been running this huge behind the scene constantly, just not staffed well enough to be able to manage it. And now it kind of moves on rails. We really have learned a lot over the last year, and now we've made a real efficient system. In terms of when people would be coming in, we would never kind of surprise people, or try not to surprise people. That the earliest notice that we have for anybody that would need to be isolated, quarantined, hospital decompression, for the hotel operator or general manager, I usually send an email saying, hey, there's an issue that might be coming in the county. The hospitals are indicating that they have kind of a full status, just being on alert. Or if the moment that weather change of pattern is going to happen, like an ice storm were to be coming, my unit would find out way in advance of anybody else in terms of meteorological estimates. And then I send an email out to folks in the area saying, hey, this could become an issue. Not that it will, but it could become an issue. And the moment that we know, we'll alert you. So we would look for rooms.
Great. Thank you so much. So you mentioned that we have over 70 lodging partners already throughout Oregon that have active agreements and are providing shelter for much needed situations for different reasons across the state. If you had a goal in mind for how many additional lodging operations you would have beyond the 70 plus that we currently have, what does that look like in your mind to actually meet the demands that you're anticipating over the coming years?
I get a little ambitious. My boss tells me that maybe I'm not very realistic. But when I take a look at Cascadia, for example, the need that over 26,000 families would be displaced as a result of that, I just think of, wow, that's a lot of rooms. And so the other piece that I try to do is, if at all possible, try to get in every community. I don't care how big or how small. They usually have a hotel and a motel, to have a contract with every single town that we have in Oregon, and obviously as many as possible in the large metropolitan areas, because even if that contract sits, right, and we just establish an initial partnership, when Cascadia strikes, we will end up filling practically every room in the state. That's just what will happen. And the reality is the hotels will be impacted, right? And general managers, family and friends will be impacted. And so everybody's going to have a need. And the beautiful part would be for the state, knowing that we're going to have tremendous federal aid coming, would be able to support hotel operators and hotels during that time. right? So that we could then make sure that everybody is fiscally whole during that time and provide great capacity. So Jason, I know I didn't give you a number per se, but as many as possible. I've told our contracts and procurement office that in order to be able to address this need, we would probably need to exceed what we have currently by 100-fold.
Okay, that's helpful. And it's also good to hear kind of the community by community approach where you have some partners in place across as many locales as possible in Oregon.
Yep.
So thank you for sharing that with us. I guess my final
wanted
thought.
to-
Oh yeah, please.
I was just going to chime in that, you know, that 76 or 78 hotels that are working with Jeff and the state of Oregon, that doesn't represent like all of the contracts and agreements that are in place with local public health authorities. Those sit outside of the state system. So while we are encouraging those partnerships, that's between local government and the hotels and motels. In terms of where we're at with COVID numbers, you know, we're going to have about 1,000 new cases today. That's about where we're sitting day over day. And that's where we're going to stay for the next little stretch of time. Out of those 1,000 cases, we could guess that maybe 20% are going to need help with shelter or foods, services like that. Out of that number, a chunk are going to need hotel or motels. The numbers are very real right now. They continue to be very real. And, you know, we're looking for those solutions on any given day. I talk with, you know, local public health administrators weekly. And even, you know, just last Friday, they were talking about, you know, having a person who didn't have a home to be in, and their only option at the end of the day was to tell that person, I'm sorry, but you're going to be on the streets tonight because I don't have anywhere for you to go.
This is Dolly. Sarah, I've had similar stories where the best we could do is, you know, give the person a gas card so they can be in their vehicle, or a tent so that they would be dry. And if you're ill and we're needing you to recover, these aren't great solutions. I would just put a plug in for what I've heard. We need more sheltering options in the coast, like Clatsop. I've had need in Lake and Klamath counties. So literally every county we need support.
All right, well, we did our best to cut through the red tape today to provide you with names and faces and direct contacts. Over the course of the last couple of years, of course, the importance of sheltering and how lodging operators can be better partners with local government and state government has come up time and time again. So we know this webinar will be a resource for months to come. And just want to thank again, Jeff, Dolly, and Sarah for taking time out of your day to put it all together in such a compact fashion. And thank you to the Orla members that were able to join today. Wishing you all the best this afternoon and the rest of the week. Take care.